morning. Dr. Richard Buckley here at MilfordMD. You awake?
I'm awake.
Why are you laughing? Just all funny?
Because I'm just enjoying our time together.
Okay, right. So our time together today is going to be one of a little bit of liposculpting. Our patient's very slim. There's a little bit of some loose skin, a little bit of some odds and ends of fat it loves, for example, to hang out around the belly button, so kind of a bagel of fat. So we're going to be sculpting that, and then we're going to be blasting the fat off with our Vaser device, and then we're going to be suctioning fat out. Those cells will be gone for good. And then we're going to use renuvion plasma energy to get some shrink propping going, some tightening. You know, just like that stuff you put up for winter sometimes and you hit with the dryer. We're going to do the same kind of thing here, even though we're getting into spring. I've made a little entry point right here and put a tiny little piece of plastic there to temporarily to protect the skin from our Vaser device. We'll use the device to bounce the fat cells off in a moment. Maybe we'll bring you back and show you Vasering. We need kind of a morning to do whatever sculpting project we're doing. Patient's always awake and comfortable. Sometimes we do upper lower abdomen. Sometimes abdomen, waist, and hips. Sometimes we do outer thighs and front of the thighs and inner thighs, inner knees, arms, neck. Breast liposuction to reduce them. Or we take fat from other areas and we put it in someplace, maybe the breast, maybe the buttocks, for fat augmentation with living fat cells, known as fat grafting, or AFT, AFT being autologous, your own fat transfer. Richard Buckley, MilfordMD. You remember this morning's project is the liposculpting and tightening of our patient's abdomen. Patient is awake and laughing.
Awake and laughing, here I am.
Right on cue, there you go. And I'm Vasering. Laughing, Vasering. Comedy routine. But we're quite serious all the time. So our Vaser is sound, ultrasound, and it's bouncing fat cells off of where they're adherent. You might see, for example, I turned it off a second, and it's kind of, let's say, sticking right there. It's because there's a glob of fat in its way. If I press the pedal, and you'll hear a sound maybe, an ultra kind of a sound, and now you can see that, well, okay, we have blasted our way through that pesky fat. You see that? We blasted our way through. So after I'm done using the sound waves to loosen all of our fat here, we're going to suck that fat out, gone for good. And then we'll show you renuvion tightening. We use local numbing fluid, local meaning I just put it where our patient needs it. She needs it in her abdomen. You can see a little bit of a color change between here and here. It's a little lighter in color. It's because there's epinephrine in there, in our numbing solution, which helps minimize bruising. You can hear that ultrasound because our patient is so slim. Slim doesn't mean that you wouldn't benefit from tightening. In fact, we have patients, some who are very, very, very slim, but they have a lot of loose skin. Then we need to get our renuvion plasma energy out to get that tightened. This is Vaser. Renuvion is coming up next. For watching MilfordMD.